Good morning, dear students. Today we will discuss about the physiological changes occurring during pregnancy. We will see what is normal pregnancy. As you all are aware, normal pregnancy begins when a sperm fertilizes an egg. The normal duration of pregnancy is about 9 months. During this period, the body of woman provides protection and nourishment for the development of the fetus. Pregnancy ends at delivery when the baby is born. Pregnancy is a state of dynamic physiological adaptations to meet the demands of a developing fetus, childbirth and lactation. The normal duration of pregnancy is 40 weeks. This is calculated from the first day of last menstrual period. This means the normal duration of pregnancy is considered as 9 months or 40 weeks. The normal duration of pregnancy. The normal duration of pregnancy is 40 weeks, which is already discussed earlier. And these 40 weeks are divided into 3 trimesters. First, second and third trimesters. First trimester means from conception to 12 weeks of gestation, and second trimester means from 12 weeks of gestation to 28 weeks. Third trimester means from 28 weeks of gestation to 40 weeks of gestation. This slide shows the growth of fetus happening during each trimester. There are certain physiological changes occurring in every system of the body. These changes are natural and normal. These changes enable her to nurture the fetus, prepare her body for labor, develop her breast, and lay down stores of fat to provide calories for production of breast milk during the puerperium. By understanding the normal changes as a midwife, you can detect the abnormalities. Now we will discuss about the changes occurring in all genital organs like vulva, vagina, uterus, isthmus, cervix, fallopian tube and ovary. Changes occurring in the vulva. Vulva becomes edematous and more vascular. Superficial varicosities may appear especially in multipara. Labia minora are pigmented and hypertrophied. Changes occurring in the vagina. Vaginal walls become hypertrophied, edematous and more vascular. Hypertrophied means enlargement occurring, and this is due to increase in size of the cells. Increased blood supply to the venous plexus surrounding the walls give the bluish coloration of the vaginal mucosa, and this bluish coloration of the vaginal mucosa is called Jacquemus sign. The vaginal secretion becomes copious, thin and curdy white. Copious means increase in quantity or the secretion become more, and this is due to exfoliated cells and bacteria. The part of the body which undergoes the most significant changes and is affected first during pregnancy is the uterus. It increases to 20 times its original weight, that is from 50 gram to 1000 grams. The capacity of the uterus must expand to normally accommodate a fetus and the placenta, the umbilical cord, and 500 ml to 1000 ml of amniotic fluid and the fetal membranes. The volume of uterine cavity increases to around 5 liters. The amount of its muscle, blood vessels and nerve increases. By the time the pregnancy has reached term, the uterus will have increased 5 times of its normal size. Now we will see the changes occurring in the muscles. Number 1, hypertrophy and hyperplasia. Okay, this occur under the influence of the hormones estrogen and progesterone. What do you mean by hypertrophy? Hypertrophy means the muscle size is increased, whereas hyperplasia, there will be increase in the number of cells. These two changes occurring under the influence of the hormones, that is estrogen and progesterone. Number 2, stretching. The muscle fibers further elongate beyond 20 weeks due to distension by the growing fetus. The wall becomes thinner and at term it measures about 1.5 centimeter or less. That will be the thickness of the uterine wall at the term. Now we will discuss about the arrangement of the muscle fibers. There are 3 layers of uterine muscles, namely outer longitudinal layer, middle or intermediate vascular layer and inner circular layer. The middle layer is the strongest layer, arranged in crisscross pattern. The muscle fibers give the figure of 8 form. It is called as a living ligature, as when the muscles contract, they occlude the blood vessels running through the fibers. This image shows the arrangement of the 3 layers of the uterine muscles. Now we will discuss about the vascular changes occurring in the uterus. During pregnancy, the blood supply to the uterus is through uterine and ovarian arteries. The diameter of the uterine artery becomes double and the rate of blood flow increases to 8 times more by 20 weeks of pregnancy. And the vasodilation is mainly due to estradiol and progesterone. The veins become dilated and are valveless, and these vascular changes are more evident at the placental site. During the second half of pregnancy, the uterine fundus enlarges more than the uterine body. Next we will see the changes in the uterine weight. The weight of the uterus increases from 50 grams to 1000 grams, that is about 20 times increase. The uterine weight is increased due to the increased growth of the uterine muscles, connective tissues and vascular channels. This slide shows the changes occurring in the pregnant uterus. Next we will see the changes occurring in the shape of the uterus. The normal shape of the uterus is pyriform, that is pear-shaped. During the early months of pregnancy, the pyriform shape is maintained, and by 12 weeks of pregnancy, the shape becomes globular. That means globe-shaped or spherical. The size of the uterus increases as the pregnancy advances, and by 28 weeks, the uterus again becomes pyriform or ovoid in shape. Ovoid means egg-shaped. By 36 weeks, the shape again changes to spherical. This represents the changes occurring in the shape of the uterus during pregnancy. The changes in the position of the uterus. Normal position of uterus is anteverted, anteflexed. Up to 8 weeks, the uterine enlargement will occur by maintaining this position. Anteverted means rotated forward towards the anterior surface of the body, and anteflexed means flexed towards the anterior surface of the body. The enlarged uterus may lie on the bladder, and this leads to reduced capacity of the bladder, and the pregnant mother complains of frequency of micturition. After 8 weeks, the position of the uterus becomes erect, and in multipara mothers, the abdominal wall is lax, that means relaxed, and there is a tendency to occur anteversion. But in primigravida, there is no such problems. Normally, uterine contractions occur during the time of labor, but uterine contractions can occur during pregnancy also. This is called as Braxton Hicks contraction, and who first described this? The contractions are irregular, infrequent, spasmodic and painless, without any effect on dilatation of the cervix. During labor, there will be regular painful contractions with gradual cervical dilatation. But in Braxton Hicks contraction, this is not occurring, and this is otherwise known as false labor or false contraction. Next is endometrium. The endometrium of the pregnant uterus is called as decidua. Here the structural and secretory activity of the endometrium is increased during the pregnancy. Next we will see the changes occurring in the isthmus. During the first trimester, isthmus hypertrophies and elongates to about 3 times its original length. It becomes softer, and as the pregnancy advances beyond 12 weeks, it is incorporated into the uterine cavity. Next, the changes occurring in the cervix. There are hypertrophy and hyperplasia of the elastic and connective tissues, and fluid accumulates inside and in between the fibers. Vascularity of the cervix is increased, and all these leads to marked softening of the cervix, and this is called as Goodell's sign. This is evident from 6 weeks of pregnancy, and the secretion becomes copious and tenacious. Copious means profuse, and tenacious that is like a gluey or having a sticky consistency, and this is known as leukorrhea of pregnancy, and also it becomes very bulky. Changes occurring in the fallopian tube. The total length of the fallopian tube is increased, and the tube becomes congested, and muscular hypertrophy occurs in the fallopian tube also. Next, the changes occurring in the ovary. The corpus luteum produces progesterone to help maintain the lining of the endometrium in early pregnancy. The corpus luteum enlarges during early pregnancy. It functions until about the 10th to 12th week of pregnancy, when the placenta is capable of producing adequate amounts of progesterone and estrogen. It slowly decreases in size and function after the 10th to 12th week of pregnancy. The follicle stimulating hormone, that is FSH, ceases its activity due to the increased levels of estrogen and progesterone secreted by the ovaries and the corpus luteum. The follicle stimulating hormone prevents ovulation and menstruation. Next we will discuss about breast changes. The changes in the breast are more evident in a primigravida. In multipara who has once lactated, the changes are not clearly defined. Marked hypertrophy and proliferation of the ducts and alveoli occurs in the breast, and this leads to increase in the size of the breast, and which will be evident from early weeks of pregnancy. This picture shows the changes occurring in the breast during pregnancy. The nipples become larger, erectile and deeply pigmented. The sebaceous glands, usually 5 to 15, that which remains invisible in the non-pregnant state in the areola, and this become hypertrophied, and this is called Montgomery's tubercles. These are placed around the nipples, and the secretion from this keeps the nipple and the areola moist and healthy. Secretion, that is colostrum, can be squeezed out of the breast by 12th week of pregnancy, and during second trimester, secondary areola appears around the primary areola. This is the picture of Montgomery's tubercles.